Welcome to today's GNCC Espresso Live with our distinguished guest, the Acting Medical Officer of Health for the Niagara Region, Dr. Hirji. Dr. Hirji, thank you so very much for being with us today. My name is Mishka Balz. Wonderful. My name is Mishka Balzam, and I will be your moderator for the next hour. Since launching our webinar series, we have spent much time on looking at the economic impact of COVID-19, the information and subsidies needed, tax and legal implications, municipal consequences, and we have heard from business leaders about the measures that they have put in place to strengthen their businesses. While organizations and governments are responding to the ever-changing pandemic impact, businesses have questions, and we're very privileged to have you, Dr. Hirji, with us and agreed to join GNCC's Espresso Live webinar series on a monthly basis, especially during these critical times. Dialogues such as this one are only made possible due to partnerships that support them. And our appreciation goes to Norton Biotech for all that they do for Niagara, us as a community, and internationally for the biotech sector. And here's a message from Norton Biotech.
This is Norton Biotech. We are a biotechnology manufacturing company based in Thorold, Ontario, Canada. This has been a busy year for us, with plans in motion to expand our facility, as well as producing testing kits for COVID-19. The people of Norgen have been working hard to serve their community. Now let's go see what the people of Norgen are up to. Hey Pam, do you mind telling us what you do here at Norgen?
Hi, sure. So I'm the Quality Assurance and Regulatory Manager at Norton. So I oversee our ISO certifications and our quality management system, as well as work on regulatory submissions for our products with Health Canada, FDA, CEIVD as well.
Let's go to the lab to talk to our scientists.
So I'm a research scientist, and I'm going to isolate the RNA from all the samples that we received to be sent for sequencing.
I am a researcher on our NGS team, and my job is to take the RNA that we isolate in the lab, put it on the sequencer, and then send it upstairs for analysis.
Let's head up to bioinformatics then, shall we?
I'm a bioinformatician here, and we analyze all the sequencing data based on customer needs.
This is only a portion of the work being done at Norgen. While each of these departments is essential to our success, we're thankful for our team in manufacturing for making our work possible. Although we make hundreds of kits, we'd like to focus your attention on what we are currently working on, which is our saliva collection device, as well as what we are doing to facilitate COVID-19 testing.
COVID-19 detection all starts with the sample. The sample can be collected through saliva or swab, is preserved and shipped to our lab. Once it's received by our lab, we isolate it using our silicon carbide technology. The samples then undergo PCR testing for the detection of COVID-19, which can be further analyzed by our NGS team.
The Ontario government was very instrumental during this pandemic, and it supported businesses across the province. We also get support for developing our novel saliva collection and preserving device.
Thank you, Dr. Haj. Thanks for watching, and stay safe.
And thank you for the team at Norton Biotech for all that you do, and especially for supporting today's dialogue. I am not sure if today's guest needs a really more formal introduction, since he is a household name by now. Dr. Mustafa Hirji, the Acting Medical Officer of Health for the Niagara Region, was appointed to the position in January of 2018. And in his capacity, he is responsible for protecting the health of Niagara's 450,000 residents and 14 million visitors through public health programs such as vaccination, preventing chronic diseases, health inspections, enabling children to get the best start of life to life, as well as land ambulance and dispatch services and emerging planning. So thank you very much for being with us today. And to just talking about the format for 1 second, Dr. Hirji will provide an update at the beginning of this webinar, and which is going to be followed by an interactive Q&A session. I encourage you to utilize the chat function or the raise the hand for any live questions that you want to ask during the Q&A session. And on that note, Dr. Hirji, over to you.
Okay, thank you so much, Mishka. So as we said, I'll quickly do a quick update, and appreciate everybody who sent in questions in advance. I've tried to maybe hit off a few of those here with some visuals to hopefully address those, so we can then get those answers with a bit more color than I would have been able to provide otherwise. So hopefully everybody has my slides up. Just want to make sure of that. Mishka's nodding her head, so that's good. So I'll start off just by showing what the daily case curve has looked like in Ontario, which is where I started off actually last month. And last month we were right about here where we were just seeing possibly the first signs that maybe we'd peaked. And fortunately that has actually played out, and we can see that Ontario's cases have actually been declining for a little over 3 weeks now. It's really since actually the last Espresso that I was here for. So that's very good news, I think, exactly what we need to see happen so we can get towards the point where we can start to reopen things. One thing I just want to hopefully highlight here is that you may see how steep the line is going up and coming down, and you may be able to appreciate that it's not quite as steep coming back down. And I'll actually just draw in a vertical line here, which makes that a bit more apparent that it was steeper going up than it is coming down. And that's a bit of a change from the second wave where it was much more a mirror image across a dotted line. And so unfortunately, it does look like cases are coming down a little bit more slowly than they went up. And the reason for that really has to do with variants. You can see here that the blue bars are the non-variant cases, the orange bars are the variant cases. And really over the months of February, March, the variants took off and basically displaced the non-variant cases. And now we have basically 90+% of cases in Ontario are variants. And the variants spread more easily. And so it's therefore more difficult to control them. And we're unfortunately seeing that in terms of it being more difficult to bring those cases down. Just to quickly show you, a numerical value here, this is the reproductive number. And the idea of the reproductive number is that for every case of COVID-19, how many additional cases result from that because if it spreads to other people. If you have a reproductive number of 1, that means you're going to basically stay flat in the number of cases you have because every case will create 1 additional case on average. If it's above 1, that means every case is creating more than 1 cases on average, and you're going to see cases grow over time. If it's below 1, that means every case is going to lead to fewer cases over time, and so you're going to see a decline. And you can see that we in Ontario are below 1, which is exactly what we want, and so cases are coming down. But you can see where it is right now versus where it was during the second lockdown back in January and early February. And you can see it's not quite as low. And that just numerically shows that the lockdown we have right now is unfortunately not as effective at bringing cases down. And I think that's really because of the variants that are in place. Now, I think a key question for everybody in this audience and probably most of society is, when does this mean we can hopefully start to reopen? And so doing a very crude analysis here, I'm just going to kind of draw in a trajectory of if we kept up with this current pace of cases coming down, when do we get down to a much lower level? And so to get back into the range of the provincial color-coded framework, you can see we're probably in the early part of June. To get it to quite a low level, which is more similar to what we had in last summer, we're probably looking maybe closer to, late June, maybe mid-June at the earliest. And so, the province has extended the stay-at-home order to early June, which I think was unfortunately necessary to get us down to somewhere around here. I imagine we'll probably need about another 2 weeks to get it down to a region where it is much lower, where we're actually going to be able to then continue to suppress it with contact tracing and the like. And so I'm unfortunately expecting that we'll probably see the stay-at-home order go on to closer to around mid-June. And I'll come back to that timeline in a couple more times over the presentation. Switching away now from the Ontario perspective, just to the Niagara perspective, this is now looking at the reproductive number in Niagara. And you can see it's below that 1.0 line, but higher than it was during the second lockdown. And so again, we're not seeing cases come down quite as quickly as I think with the second lockdown. But the good news here is that when we look at the daily cases in Niagara, it is actually declining more sharply than it was for the province. The province was not quite halfway down. I think we're past halfway back down to a very low number. And so I think that's good news for what's happening in Niagara here. I'm just going to skip over here and take a quick look at, this is some of the provincial modeling that predicts what could happen. So this is a little bit old now. This is the modeling that they came out with in early May. And they were showing a few different scenarios of what would happen with, a 1-month stay-at-home order. You lift the stay-at-home order on May 20th. you'll see an effect continue on, and then cases would start to go up. And there's scenarios where you didn't have a stay-at-home order and cases would keep going up, and then they'd surge more quickly. With a stay-at-home order, you'd get them down and then they'd surge more quickly, and then they suggested a more intense stay-at-home order where cases would come down lower, but once you lifted it, the cases would go back up. Where we are right now in Ontario is where, today we're actually under 2,000 cases. The last few days we've been in the low 2,000. So I think we've actually been tracking somewhere between the yellow and the green lines. And so we would probably be on a trajectory somewhere in between these two. Fortunately, with the province extending the stay-at-home order for a couple more weeks, I think that does mean we probably track down a bit lower before we start to see things go up. So I think that is going to set us up better. But again, I do think there's with cases going to rebound a little bit, with hospitalizations and people going into the ICU rebounding with that, we probably do need to see the stay-at-home order go on a little bit longer so that we have a chance to relieve the pressure on the hospitals. So when we do see that bounce, when we do reopen, it's going to be as small as possible. You can see, depending on where you reopen and how low cases are, that bounce becomes smaller, and we of course want it to be very small. The other bad advantage, of course, with a later reopening is there'll be more vaccine out there, and I think that will actually then suppress how much cases could potentially rise again. Taking a quick look then at what hospitalizations look like in the province right now, you can see hospitalizations are starting to fall, which mirrors with cases having fallen. So that's, of course, good news. Less positive is with what we're seeing in ICUs, where it is coming down, but you can see it's come down quite slowly so far. And that's unfortunately because people who get admitted to the ICU are much sicker. They need a lot longer stay in hospital before they're going to be well enough to get out. And so we see this line is going to probably come down much more slowly. You can see after the second wave how slowly it came down compared to overall hospitalizations. And so it's going to be a while, I think, before we really fully see hospitals relieve their pressure, particularly in the ICUs. And one thing I just want to highlight here is the province used to have about 150 ICU cases was sort of their danger threshold, and we're of course way above that. And the reason we're way above that is because hospitals have been able to cancel a lot of other procedures, particularly surgeries for cancer patients and the like, to repurpose those areas of the hospital and those staff to working for intensive care for COVID patients. And there's a big backlog now of surgeries that have piled up in the province, which is going to be one of the things that we're going to have to unfortunately grapple with once we get past the pandemic, are able to reopen our hospitals, is really catching up with all of these people who've had their surgeries deferred. Just quickly touching on the provincial modeling now of what's going to happen with ICU stays. We're actually around 700 or so ICU stays, so we actually seem to be tracking closer to the green line here. And you can see that this is a fairly gradually declining line, just kind of drawing in a little bit of an extension. If we continue that trajectory, you can kind of see that this would be maybe another 3 weeks out. We would still be sitting at a couple hundred people in the ICUs. That's 3 weeks out from mid-May or the end of May. So that kind of aligns again with that middle of June timeline, where I think hospitals will be getting close to that 150 threshold, where it probably makes sense that there's enough buffer room that it's safe to reopen. And just the final thought along these lines is this is some modeling done by the Public Health Agency of Canada. This is looking at hospitalizations. This dotted line here is the hospital capacity that they see in the country. And what they're showing is that if vaccine uptake is around 55% of adults, if you reopen, you're going to see a surge of cases, which is going to exceed our ability of hospitals to cope. And so they were arguing that 55% vaccination isn't going to be quite high enough where vaccines are going to protect us. But if we get up to 75% of adults are vaccinated, we actually see that there is no real significant bounce. We stay well within what our hospitals are able to sustain. Now, as it stands in the province and in Niagara, we're at about 45% of people vaccinated, 55% if we're looking just at adults, as these graphs are. And I think it's going to be probably second week or so of June that we get to 75% of adults vaccinated. And so this timeline that if you're using 75% of people vaccinated, again, times with about mid-June when we're going to be able to really reopen society. And so I think that's kind of what we can expect going forward in terms of what's likely going to happen. Just going to switch over then to quickly talk about vaccinations. This is the coverage that we have across different age groups in Niagara, and you can see we've done very well with some of our older age groups where we've been slowly able to keep increasing that number well above the 90% line. We're making progress now with some of these younger age groups where we more recently opened vaccination. And I'll just draw in what the number of people who are booked into vaccinations are right now. And you can see that, even with these elderly age groups where we almost vaccinated most people, we're still making a little bit more progress in getting more people in the queue for vaccinations. But the groups which most recently opened for vaccination, we've got lots of people right now in the queue with appointments. Obviously, we're going to need to do more work to keep bringing those numbers up so they start to match some of these age groups. But you can even see with the 18 to 29 and 30 to 39 year age groups, which opened this morning, this is data I pulled as of 1 o'clock that we already had a lot of those people signing up to be vaccinated. So there's definitely some good progress happening here, but it's going to take time to actually get these people through their appointments over the next few weeks and to keep building those numbers up higher. But as I said, we're at 45%. This becomes 55% if we're looking just at adults and leaving out those younger than 18 years of age. We've already got another 10% in the queue, and we'll hopefully then get to 10% more in the queue in time to have people vaccinated, 75% of adults by mid-June. Last thing I just want to highlight here is the province. This is what they put out a few weeks ago in terms of different age groups becoming eligible. Of course, everyone has now become eligible as of this week. But over the last couple of weeks, you can see the provinces allocating vaccine where half of vaccine was going to each public health unit across the province and half was going to hotspots, with most hotspots being in the GTA. So Toronto, Peel, York Region, Durham Region, that's where most of the vaccine has been going the last 2 weeks. It is now actually going to be allocated starting this week on a more per capita basis. So we're going to see more vaccine coming to Niagara. And you may have noticed over the last couple of days, if you looked at our vaccine stats on the website, we've increased the number of vaccinations that we've been able to do here in Niagara, particularly at our public health clinics. And that's a reflection that we now have a bit more vaccine thanks to this shift in the allocation. The province announced yesterday that all adults would be able to schedule their appointments starting today. And just to give you a sense of what that means, that 18 to 39 age group who became eligible is about 128,000 people who are suddenly eligible in Niagara for vaccinations. And we know by the end of the month, the 12 to 17 year age group is also going to become eligible for vaccination. So we're looking at getting close to 160,000 people to become eligible for vaccination in the next couple of weeks. Unfortunately, when we look at our supply, even with the increase in vaccination supply, we're right now getting on the order of about 20,000 doses of vaccine, at least between public health and Niagara Health. There's a little bit more vaccine going to go to primary care and pharmacies, but you can see that the eligibility of vaccination is now quickly overtaking actually the amount of vaccine we're receiving. So one caution, unfortunately, for many of the people who are becoming eligible for vaccination as of this morning is that they're probably not going to get an appointment in the near future, just given the speed at which we're getting vaccine. They'll hopefully be able to get an appointment a little bit farther out, and they'll have the good luck to know when their vaccine appointment is going to be. But it's going to take some time of a few more weeks of getting these many doses and hopefully maybe an increase in that to be able to really vaccinate the full group here who is now eligible for vaccination. But as we work through that, as we get to that 75% of adults by mid-June, this is some information put out by the Public Health Agency of Canada, really advising what they see happening. And I think this is the news we all want to see, which is that once we have 75% of adults vaccinated, we're going to be able to start to have some restrictions left. We'll be able to, look forward to having small outdoor gatherings, meeting with friends and families, resuming things like camping, hiking, picnics, patios, they outline here. And I think actually we're going to be able to hopefully see most of our businesses able to resume serving the public, getting back to really where we were in the latter half of summer last year and seeing something very similar to that. And that's what I'm hoping to see in July and August. And then by fall, we'll hopefully get most people having 2 doses of vaccine. And once we get to 75% of people having 2 doses of vaccine, which I realistically think will happen by late September, we will actually be at a stage where we can start to have a lot of indoor activities resume. So indoor sports, indoor family gatherings, colleges and universities will be able to resume their normal activities. And I think a lot of businesses will then be able to really start to resume normal activities. And I particularly think of something like restaurants, which have really struggled to have indoor dining. They will be able to have indoor dining come next fall. And that'll be achieved because we'll be able to get enough vaccine out into people. And so I think there's some good things that we can look forward to. We just have about another 4 weeks or so where we really need to buckle down so that we can actually make all of this possible in a safe way. And with that, I think hopefully promising note, I'll stop there and turn it over to questions.
Okay. Thank you very much, Dr. Hirji. That has been very informative. And with your graphs and information, you have actually answered a couple of the questions that certain individuals actually have brought forward. So it's good for us to skip that. I'm also really, it's really nice to see from our participants today a number of questions that are coming in too. And please know that we're really committed to getting to all of them. So we're seeing them coming in, and I'm hoping to address them in the next upcoming couple of minutes. But there were a few questions that had been pre-submitted to us either via our social media channels, email, or in any other way. And I wanted to reach out to some of that because we're talking about an ideal situation, and that is talking about 75% of adults being vaccinated. But the vaccine hesitancy will make it challenging for some regions, provinces, and countries to reach 70% or 75% with a COVID-19 vaccine. We have seen vaccination rates flattening in countries such as the United States and the United Kingdom. If countries don't reach, if regions don't reach a 70% or 75% immunity, what does that mean to residents and businesses?
Yeah. What unfortunately that would mean is that there's going to be less opportunity to reopen quite as quickly. What that means is we need to drive cases even lower before we reopen. And so that I think would not be what we want to see. I'm actually pretty hopeful that most parts of Ontario will get to 75%. And just flipping back here to what we're already seeing, where 45% are already vaccinated, another 10% gets us up to 55%. And this is of all people, including everybody from newborns through to as old as possible. If we're looking just at adults, we already have then 65% of people vaccinated are in the queue. So we only have another 10% to go to get to that 75%. There's a lot of people here who I think have just recently got the opportunity to book a vaccine, who I think there's a lot of opportunity to get them into the queue. And one of the things that we've noticed with our older age groups is as we've gotten more and more vaccines, as we've got farther into the vaccination campaign, we've been able to slowly keep increasing that number. There's an early adopter group who quickly signs up and you get them vaccinated. And then once we figure out who has not signed up for vaccination, we start doing actually a lot of targeted advertising. We've bought some marketing data to understand what are the different populations in different parts of the region. We figure out what are the areas where we're not seeing quite as high uptake of vaccination, what are the profile of people and what kind of messages will resonate to them. And we actually start doing some targeted advertising. So really trying to learn from what the business community is probably doing for 20 years, trying to do some of that ourselves. And we've, saw as earlier I showed, getting 98% of, the 80 plus, the 75 to 79 group now vaccinated. So we're slowly picking away at that group. So I really am very optimistic we'll manage to get to 75%. I think we probably won't as easily get to something like 90 or 100% with the whole of society, but I think we'll be high enough that we'll be able to reopen.
Can I just ask you a follow-up question on that? And that's, we're often being asked to say in Niagara, we're hopeful to get to 75%. What if our neighboring regions and communities don't get to the same percentage? And what does it mean to individuals and businesses for us right here in Niagara?
Yeah, no, that's a really good question. If the vaccination rates aren't as high in our neighboring region, and that's particularly a region where we're going to see lots of people coming in here, it does effectively mean that the average of the people in Niagara is probably going to be a little bit lower. So it does create risk that infection is going to still be able to spread. The province is tracking pretty closely to where we are. So I imagine it's not going to be whole regions that are going to be like that. It's going to be more small pockets of communities that struggle to get their vaccination rates up. And one of the things I see really happening over the next few months is as we, vaccinate the large majority of people through mass immunization clinics, our work in public health is going to really shift from running big clinics to really doing intense outreach to those groups who aren't getting vaccinated to hopefully get that number up.
Yeah, and we say the same. We see similar initiatives actually south of the border too that have actually identified the same and wanting to move forward differently.
One thing, actually, if I may just quickly add there,
Yep.
the question alluded to what's happening in the U.S. And if you look at the U.S. data, they absolutely are plateauing. It's really interesting that if you look at the Canadian data, we're accelerating, and the U.S. and Canada are now actually almost at the same point in terms of people with first doses. But they're flattening out and we're accelerating. So we're actually soon going to be overtaking them.
Yeah. You know what, while we're talking about the United States, this has been another question that has come in, and then I will get to some of the participants' questions, which are all around the same topic. So according to the US Center of Disease Control, just around 50% of the US population has at least one dose of COVID-19 vaccine, and 32% are fully vaccinated. Now, they made the announcement that fully vaccinated Americans have been told they no longer need to wear masks outdoors unless a large crowd of people can resume domestic travel without taking COVID-19 tests, and no longer need to self-isolate after arriving from an international destination, and can visit others fully vaccinated people indoors without masks or physical distancing. And the questions we've been receiving from the community have been, is that what is in stock for us? Is that what we are anticipating here as well?
Yeah, I think that's absolutely what we can anticipate in actually not the too distant future. I'm thinking 4 to 6 weeks from now, we'll see a lot of that lifted. I don't know if we'll exactly mirror the US, but I think we'll take some big steps, particularly in terms of not having to wear masks, particularly when we're outdoors. I talked about, we'll be able to start having those outdoor gatherings once we get the 75% adults vaccinated, which is only about a month away. So I think that's absolutely what's going to be in store for us as well.
I really think that the public would probably really appreciate hearing more about that. Because even for people's mental health and well-being, as to saying, and especially as many people have also delayed taking holidays, taking time off and other things. And I think it would be good for people to know what to expect down the road. And I think it's such an encouraging message too for people to get vaccinated, and saying that the old stigma of we're all in this together and can make a difference. But here's the question.
It gives us the motivation to kind of stick with some of the intense restrictions for just a few more weeks, so we can get to that positive point.
Fully agree with you, actually. This is a question from Chris, who is with us today, and they're asking, what advice do you have to talk to vaccine hesitant individuals that are in close contact with family members? Are there any good resources that are available, and to have conversations with them? And I think it's something that we all face, and in many ways that what Chris is bringing up has actually surprised us in our own circle, the response that people have had to this crisis. But any advice or any support information, we can follow up with all participants afterwards too, but anything that you suggest?
Yeah, so in terms of a resource, we actually have a page on our public health website to niagararegion.ca/health/COVID-19, and you'll be able to find the page from there. That will give you some resources linked to some other resources. In terms of what I would do with those persons, I think the first thing you should do is really accept them for where they are, not try to push back or criticize them or attack them for not choosing to get vaccinated, because I think that causes people to dig in their heels and really become more strident about their position. So you want to be respectful, understanding of it, and then try to explore what are their concerns. Perhaps they have heard some misinformation, perhaps there's something you can bring them that would give them a bit more understanding, and that'll helpfully help bridge that gap. I think helping them see who else in the family, who else in their social circle has gotten vaccinated will hopefully dispel some of the fears when they see that lots of other people got vaccinated. It was a good experience, that'll maybe reinforce that positive experience for them. And then I think the final part I would do is really encourage them to speak to their healthcare provider. We see that speaking to your physician, your primary care provider, is actually the #1 most influential thing for someone who's vaccine hesitant, helping them convince them to get vaccinated. That's someone that people generally trust, and really encouraging to have a conversation about their concerns with them could hopefully be the difference of hoping to get them vaccinated.
That makes sense. I'm shifting topics here, and it's partially driven by the number of questions that have come to us, and they are related to AstraZeneca. There's uncertainty on when we and when Canada will receive deliveries of more doses. And many various contracts are being reviewed, but there has not been a specific shipment that has been confirmed. Can you speak to that? As it brings up a number of questions, people's own concern with having accepted that vaccine, the question of the uncertainty of shipments for follow-up vaccines on this one, and maybe we start out there.
Yeah, so first off, just let's start off with people have got the AstraZeneca vaccine, and I'd say if you chose to get the AstraZeneca vaccine, you did not make a mistake. That was a great choice because you got immunity from COVID-19 when we were at the height of the 3rd wave, and that was a great choice. If we actually look at what the data is in Ontario, I think it comes out to approximately about 6 lives were saved by people getting AstraZeneca vaccine. Several hundred, I think, hospitalizations were prevented, and a few thousand cases of COVID-19 were prevented. On the flip side, unfortunately, there have been about 15 or so people who've had that rare clotting disorder. Nobody has died from it. We fortunately diagnosed them early, and hopefully everybody who had that is going to make a full recovery. And so when you're looking at the balance of that, 6 deaths, 100 of hospitalizations versus about 15 people who got that clotting issue, absolutely, the risk benefit does speak in favor of getting that vaccine. And if you got the vaccine, you got the benefit of protection during the worst of the 3rd wave. So you made a great choice, and we should thank you all for that, because that's partly what's helping get cases under control in Ontario. All that being said, we are seeing that with more people getting the vaccine, millions of people now around the world have gotten it. We have a more accurate sense that there is truly this clotting issue that is occurring rarely in people. And given we have, at least 2 other vaccines, the Moderna vaccine, the Pfizer vaccine, where we don't see that safety issue, it doesn't really make as much sense to keep using AstraZeneca when we have a slightly safer vaccine. And that's going to be coming in really plentiful numbers in the next few weeks. And so I think the decision in Ontario is really to take a pause on starting new people with the AstraZeneca vaccine, because there's a slightly safer vaccine we can use for everybody, and it just doesn't make sense to use this slightly, a vaccine with a slightly higher risk of a side effect. Canada, as I understand, is going to be getting more AstraZeneca vaccine, actually even just this month. And so there will potentially be the opportunity that if you got your first dose with AstraZeneca, there's going to be lots of vaccine available to get your second dose. I think there still needs to be a decision of what is going to be the recommendation for the second dose if you get the AstraZeneca vaccine for the second dose, or if we shift people to a different vaccine. The data around AstraZeneca with the second dose is that clotting issue is much rarer after a second dose. So it seems to be less of a problem. And in the United Kingdom, where they did try doing AstraZeneca for a first dose and then Pfizer for a second dose, they did see a much higher incidence of side effects, mild side effects, but nonetheless side effects. So I think we may be headed towards the recommendation being if you got a first dose of AstraZeneca, you probably would be offered a second dose of AstraZeneca as the likely second dose. I think we'll hear probably later this week or next week a final decision of what that recommendation is going to be. And there absolutely will be vaccine available by the time people are due for their second dose.
At the last webinar, you talked about a 3rd vaccination, maybe a booster shot. Can I assume that the same would apply to AstraZeneca too? So if individuals who have received the first dose of it, now with the likely shipment of the second dose being available to them, if they're in the position of needing a booster shot, it would still be AstraZeneca at that time?
I can't speak as confidently of that, because I think it'll depend on different vaccine manufacturers actually getting approved vaccine for that booster dose. It's still obviously also a question up in the air if we'll actually even need that third additional booster dose. So I'd say it's too uncertain really for me to say one way or the other yet.
No, makes sense. I'm shifting here on vaccinations. I'm moving over to Moderna and Pfizer and to address some of the questions that have come forward on it. Here's a technical, logistical questions with the pharmacies it has been easy to store AstraZeneca for them, and it's harder for them to likely handle the storage of Moderna or Pfizer. I'm making that assumption here. Is that the case, and how is it being addressed?
Yeah, so I wouldn't say it's necessarily harder for pharmacies specifically. I would say in general, those are vaccines that are more difficult to store because they need to be kept at ultra low freezing temperatures. There's also an issue where once you puncture the vial to remove a dose, you basically have to use up all of those doses within a few hours. You can't store a partial vial over for the next day to do vaccination. So you need to actually have queued up enough people every day to actually use up that full vial. What's actually happening is pharmacies already in Niagara are getting Pfizer and Moderna vaccines. So that has actually changed. Pharmacies, of course, handle lots of medications. So they actually do, in many cases, have the freezers to actually store these vaccines. So that is something that's actually up and running already. And what we're actually going to see is primary care receiving Moderna vaccine. The Moderna vaccine, while it needs to be kept in the ultra low freezer ideally, it can be kept in a normal fridge for up to 28 days. And so primary care, probably within the next week and a half, will be able to start offering Moderna vaccine, and they'll be keeping it in the fridge. They'll of course have to do the same stuff about having 10 to 11 people queued up so they can use a full vial up, but that'll be another option available here in Niagara very soon.
Makes total sense. Coming back to Pfizer specifically and Moderna probably, there's a lot in the news that we are getting significant shipments of Pfizer and Moderna actually to Canada. And a lot of people are asking if there's a likelihood that those who have received the first vaccine likely will receive their second vaccine sooner. And there's always been the question of if many people probably have questioned the call from the government to have a longer waiting period than what we see in most other countries. If you could speak to that, that would be appreciated.
Yeah, so in terms of getting the dose earlier, I think likely that is going to happen. The first group of people who got vaccinated, the 80+ age group, they're actually scheduled for early July for getting their second dose. And I suspect they're not going to actually end up getting it much earlier than that. You know, I showed there's about 160,000 people becoming eligible for vaccinations, and we're probably going to be running through most of June doing first doses for them. So I think those eldest people who got vaccinated first, it's probably going to be more like a couple of weeks earlier. As we get down to some of the younger age groups, because we'll be dealing with more vaccine, we'll actually be able to get through those second doses more quickly. So I do think some of those other age groups are going to get the vaccine earlier. I don't think it's going to be as short as a 3 or 4 week timeline. I think it's going to still be, 2 to 3 months, but it's going to be earlier than the 4 months that was initially planned. Just touching on the, benefit of getting the vaccine earlier, I just want to caution that the research is actually starting to bear out that it may actually not be the best choice to actually get that second dose earlier. The UK was one of the other countries that did what Canada did, where they delayed that second dose to really prioritize giving more first doses. And I think that's actually a very good strategy because you get most benefit from that first dose. The more people you get vaccinated with one dose, you're going to get a lot more protection in the community just by doing that. And so I think it was the right decision that we made in Canada. What we see with a lot of vaccines is that when you space apart doses of vaccine, you often actually see a better immune response. And in the UK, where they did this, there's actually just a new study done out of the University of Birmingham, where they looked at people getting the Pfizer vaccine 3 weeks apart as recommended by the manufacturer, versus 3 months apart is what they actually did as national policy. And they found that those who got the vaccine 3 months apart had about 3.5 times higher antibody levels for fighting COVID-19 than those who got that normal 3-week interval. So it does seem to be playing out that if you get your vaccine second dose later, you actually do end up with better immunity over the long term. That does mean, though, there is a short-term period where you are going to be at slightly greater risk because you won't have that maximum immunity earlier on. It's going to come in a bit later. And so there is a little bit of a trade-off there. So perhaps for some people who are particularly higher risk, it does make sense that they might want to get that second dose earlier to give them better protection in the near term when they have risk. But for most of us, actually, I think we shouldn't worry about getting our second dose much later because it's actually going to give us longer term better immunity.
No, actually, I appreciate you expanding on that one because it is a public perception. That's the idea that's there, but it's good to be informed about it. One of our attendees is asking, for those who contracted COVID, is there a recommended waiting period before they receive the vaccine?
A recommended waiting period is basically once you're done your isolation, you can go the very next day to get vaccine. So there's no waiting period. You just need to finish your isolation.
That's excellent. Uncertainty, and then I'm going to switch from the types of vaccines that there. Uncertainty remains over whether Health Canada will clear the use of the 300,000 Johnson & Johnson single-dose COVID-19 vaccines. And what appeals to people there is that it's a single dose at times. What are your thoughts of it, and what will happen there when it comes to future deliveries?
Yeah, I think future deliveries will be fine. The issue with this current delivery is you may have seen news stories about a vaccine manufacturing plant in Baltimore that the US government had to take over because they had some quality control issues there. And the Johnson & Johnson vaccine shipment we've received in Canada was actually impacted by that factory in Baltimore doing some of the production of materials that went into it. So what Health Canada is doing right now is just investigating to make sure there's not a contamination issue with the lots of vaccine we've received so they can feel confident they release it for our use. I don't have a sense of timeline of when that's happening. I certainly hope it's going to be soon and that they'll deem it is safe for us to go ahead and use that vaccine because that'll be great news. I think future shipments won't be impacted by that. I don't think we're going to get very big shipments of this vaccine, though. I think, for the most part, people in Canada are now going to be vaccinated with Moderna and Pfizer. And, I think for those of us who are able to get out to a vaccine clinic, to a pharmacy, to primary care, that's really a great option. It's going to give us a very good vaccine, which is really bearing out to be safe and very effective. And the Johnson & Johnson vaccine will be this niche vaccine for groups that it's really hard to get to, homeless people, who are transient, people where you're not necessarily going to be able to get back to them for a second dose. This will be a great option to make sure we get those niche groups vaccinated.
Oh, that makes sense. Here's a question of what the process is for international students who don't have a domestic health card to book their vaccine. And especially also looking at students who have received dose 1 while at home in another province or country or region, but will be available to receive their second dose while they're here in Niagara. How can you give us shed a little bit of light on this particular one, just how the region is planning to initiate communication with them, inform them, integrate them into our existing vaccine program?
Yeah, no, for the first part of what is the process for them. So any person is actually able to register for vaccine, whether they have a health card or not. So in theory, someone could call the provincial hotline for booking and actually get an appointment that way. We recognize with many international students, they're not familiar with Canada. They don't know how our systems work. They maybe have language barriers and the like. And so it's not necessarily the best process for them. So we're currently discussing with our colleges and university about how we might want to have a strategy for them. So it's in the works what we would do for them right now. Anybody who's able to go ahead and feels confident to do a booking, they're welcome to go and do that. For the rest, I think we still need to figure out what that strategy is going to be. As for people who've gotten a dose of vaccine somewhere else and are now here and needing their second dose, the province is currently working on the option so that people will be able to book a second dose of their vaccine. Part of the challenge here is that we don't have a record of the first dose, and so we need to figure out a way to acquire that record and make sure that we're going to be able to actually give the same vaccine for that second dose. And that's particularly a problem for people internationally who may be in a country where they're using completely different vaccines than we have here in Canada. And so there's some technological and logistics things that are being sorted out, but it's definitely something on the radar that we'll hopefully have sorted out in the next few weeks. So there'll be plenty of time to get these individuals vaccinated before the school year starts.
Oh, that's critical. And while we are talking about how this might impact the education sector, there's another question. This is coming from the Catholic Principals Council of Ontario. Will all educators have their second vaccine dose before the start of the school year in September of this year?
The goal is for the school children who have 12 to 17 years of age that they will get their second dose by August, so they will hopefully be able to return to school fully vaccinated. And likewise, the education staff that were vaccinated in April, their 16 weeks is going to be up in early August. So even if they get their vaccine only at 16 weeks and it doesn't get moved up for them, they'll be vaccinated by the time school resumes in September. So our goal is definitely that as many people as possible who are eligible for vaccination will have the opportunity to get both doses of vaccine before school starts, so we can hopefully keep schools open all year round.
Yeah, makes sense. There are, I noticed in the chat, a couple of follow-up questions to it. Please notice for all participants, if we don't get to your questions, we are recording them and we will follow up on them as well and provide them also to Niagara Public Health to follow up with you directly, just in case we don't get to them. Here's a question from Tracy. Will we need 2 vaccines in order to travel outside of the country? And there are some specific questions that are being asked here. One of them is related to travel. Another one, we have a few Ice Dogs fans with us today, and they're wondering if individuals have 2 vaccines, can they sit beside each other without a mask to enjoy watching a game? So some of more maybe specifics of what it looks like once Canadians have had both vaccines.
Yeah, I think the travel rules will still need to be worked out. Technically, we of course have no real international authority making rules. The World Health Organization will make recommendations, but it'll be up to individual countries what rules they set for people entering a country. My guess is probably it will be that most countries will want to see someone have evidence of 2 doses of vaccine to let someone in, but it's certainly possible that some countries might choose to go with just 1 dose. I could particularly see some developing countries that maybe depend on tourist travel from the developed world might want to have a slightly lower threshold to kind of err on the side of having a bit more economic activity. So we'll have to see how that plays out, but my guess it'll probably end up being you need 2 doses of vaccine. And then the second question, sorry, I forgot what that was.
I think the Ice Dogs question, am I right? Was that the one? It's just like, I think people would like to just, if you could expand of what life again looks like. Can we sit in an arena together? Can
Right.
we have dining? Can we dine together? Can we stand in line up together? Like, what does it really look like? And it's interesting that just 14, 15 months after we have started to deal with this, these are really real life questions where there's a lot of uncertainty, and especially by those individuals who are committed to following the rules that are there.
Yeah, so I think we will get to largely being able to do that probably in the fall. I talked about the Public Health Agency in Canada saying that once we get to 75% of people having had 2 doses of vaccine, we'll go back to having indoor gatherings and the like. So I think people will be able to sit indoors in a restaurant, have a meal together. We won't be limiting people to just dining with their household because there'll be a lot more protection and immunity. And we won't be worried about seeing a spike of COVID cases such that it will be overwhelming our hospital systems anymore. So I definitely think that's something we can look forward to in the fall. I think, people sitting maybe in a small group watching a sports game is going to be likely. I'm a little less sure that we're going to be filling up stadiums and having really large groups quite yet. I think that might be a little bit more delayed. I think, grocery stores will definitely be ramping down a lot of their protections. I could see, masks largely going away, maybe returning, at the height of the flu season where we're seeing maybe a little bit more infection going. So maybe it comes back for a 2-3 month period and then goes away. That's sort of what I'm anticipating going to happen. But a lot of this is a bit of predicting the future. It's, it'll really depend on what we're seeing with cases and outbreaks on the ground, and we'll probably be adapting to what we see based on that.
In your opening remarks, you talked about kind of what the future can look like for us. And a lot of businesses have asked if the region or the province will go back to this color-coded system that we had in beforehand once the foot is off the provincial emergency brake, as we are right now. And what they're asking specifically, what are the timelines to go back to what previously was called the yellow level, the green levels, the ones that really businesses were hoping for and anticipating. And I think businesses are asking these questions because there's planning that needs to take place. There's a great sense of uncertainty that's there, and just to give their future some certainty too.
Yeah, so my feeling is that the color-coded framework isn't going to really make a return, and there's probably going to be a new framework. we saw through the fall, it was introduced in November, that we pretty unfortunately quickly went into a lockdown by late December. We went into the color-coded framework in February, and by the early April, we were again in a lockdown. So I don't think there's a good track record for that framework really working. So I imagine it's going to be scrapped, and we're actually going to end up with something a bit different. But I think to the more important question of when do we get to a level where most restrictions are going to be lifted, I actually think that we could be looking around Canada Day as really being the point where we actually see most things lifted and we return to what we really saw as the summer of last year. I do think that that depends on us seeing vaccination rates get to that 75%, which I'm quite optimistic happens by mid-June. I also think we do need to drive cases down to a pretty low level. And I think that would mean we would want to see the stay-at-home order extended probably to mid-June. And then in mid-June, we could really start to open up. And by July, actually seeing a lot of things really open by July 1st.
Yeah, and I think that is looking at the different industries and sectors that we have in Niagara. This is something that really will give, I think, quite a few businesses some optimism. There's a question that has come to us, and that relates to some reports that indicate that transmission and even sickness are still possible after vaccination. Can you clarify that, maybe for those individuals who are hesitant or are uncertain on this topic?
Yeah, no, we have definitely seen instances of individuals becoming reinfected with COVID-19 after they've previously been infected or even after they've been vaccinated. Unfortunately, there's never been a vaccine that's 100% effective, so there is going to still be a risk of infection, but the risk is much, much lower, and particularly the risk of hospitalization and death is extremely low once you've been vaccinated. The clinical trials showed the vaccines were 90 to 95% effective. I think we're seeing in real world that, yeah, 90% reduction of risk that you're going to get infection, but it still means that 10% of people might still get COVID-19. But almost all of those people are getting a mild infection. They're not getting sick enough that they need to be hospitalized, or they're going to have to worry about dying. So absolutely, best, for you to choose to get vaccinated. But part of the reason we need everybody to get vaccinated is because some people, the vaccine isn't going to quite work. It's only with everybody getting vaccinated that we have enough people vaccinated that the infection just doesn't have opportunity to spread.
Yeah, that's right. There is a question, and I'm going back to, it's a vaccine-specific question, and this individual is asking to that with the Moderna vaccine, do they need to be 18 on the day that they're receiving the shot of Moderna? Or is there an age limit there, or a certain age that they have to be?
Yeah, so the vaccine has only been licensed by Health Canada for someone 18 years of age. So really it has to be someone who's 18 years of age before they can get the vaccine. The Pfizer vaccine, they've now got approval for anybody from age 12 and up. So there's a bit more flexibility there. And as I understand, actually, Moderna is going to be putting forward their application to Health Canada to actually also have that 12 to 17-year licensing. Probably by the end of the month, they'll file it. So maybe, by later this summer, that'll actually be an option for everybody. But for now, it's only 18 years of age and above. And if you're a few days before 18, technically it's not licensed.
Yeah, makes sense. And here's a question we've asked you last month on this one, but it often does come forward again, and sometimes it's a different audience, and it has to do with the US border, which we so highly depend on. We are a border community. And the question that has come forward, when the US border opens, can fully vaccinated travelers coming here, will they be able to come in close contact with those Canadians that are also fully vaccinated? What are your thoughts on this particular topic?
Yeah, so this will ultimately be a decision made by the federal government, and perhaps the federal government negotiating with the US government. So I can't say for certain what would happen. I think the reasonable decision would be that, yeah, you would allow people who are fully vaccinated to be around other people fully vaccinated. The US is using the same vaccines that Canada is using. So if they've gotten 2 doses of that same vaccine, we should be treating them equivalent to Canadians. So I would imagine that's where the decision would land, but don't hold me to it because I'm not the federal government.
Makes sense. And here's a question that is probably on a broader spectrum. It's not COVID so specifically related, but this is a question by Chris, and they're asking, when the pandemic is mostly behind us, what is your vision for the public health office coming out of this situation and moving forward. And I think that's an interesting one. We often likely are currently not asking ourselves enough, is to saying, what does the future look like for your office, for businesses, for levels of government, and so many other areas? But I'd love your take on that.
Yeah, so I have a bit of a longer answer for this, so unfortunately bear with me. I think the first thing is that the pandemic isn't going to quite end for us in public health the way it maybe will end for the rest of society. We will go into a period where, you know, most people are vaccinated, most things will reopen, and it'll feel like it's ending for everybody else. But for us in public health, we'll be chasing down that 10, 15% of the population who's not yet vaccinated. So we'll still be very intensely involved in that. We'll still see cases of COVID-19. We'll still be seeing outbreaks of COVID-19. It won't be to the level where it's overwhelming society and we need lockdowns to control it, but it's going to be actually on us in public health to be doing intense follow-up with those groups to stop the spread of infection. So we'll still be very heavily involved in those activities, I think, for quite a while. Thinking about schools, the province has actually announced that they're going to have the additional public health nurses that they put for schools for actually the following school year. So I think they've really accepted that COVID-19 is going to be a big concern in schools, and they're giving us the resources. So we'll be very heavily engaged in that. And while COVID-19 will come under control here, unfortunately for much of the world, the developing world particularly, it's not going to be under control. There's still going to be large amounts of spread of COVID-19 there. So we're still going to have travelers showing up here who potentially have infection, and we'll be doing follow-up with them in public health. When infection spreads widely, new variants can emerge, and so we'll be dealing with new variants emerging. And so I think the pandemic won't really end that quickly, and there's going to be a lot of involvement for us in public health to continue to work on that. So I think that's the first thing, that, you know, as the pandemic scales down in 6-9 months, we'll still be very heavily involved with it. I think there will be a transition where we are doing less work though on the pandemic, and we're able to start to scale up some of our other public health work. And unfortunately, when we look at the statistics for some of the other health issues, we see that they have in many cases worsened, particularly mental health. Substance use has gotten worse. People, however, are less physically active. There's a lot of health issues where we're seeing people reporting that their health has decreased. So I think it's actually going to be very busy for us, even on our normal activities, to try and make up ground for where unfortunately we've lost ground over the course of this pandemic. I think as an organization, we'll have changed quite a bit. We've been trying to become a more collaborative and flexible organization, and actually the pandemic kind of forced us to turn on a dime. And so we're hoping there's actually a lot that we can leverage to actually change ourselves as an organization. We're using technology in new ways, which I think is another benefit. We've engaged with the public with new avenues such as live chat. We're doing more on social media. Hopefully our reputation has been enhanced by the pandemic, and these are all assets that are going to allow us to deal with things differently. And then just a couple other things. I think there'll be some big after action reports about the pandemic, and we'll see what the impact of those is. The province had a modernization initiative to restructure public health. That could be something that probably still happens, and we'll have to see how that plays out. And I'm really hoping there'll be a reinvestment in public health as we've maybe hopefully gotten broader appreciation for the importance of public health in our society. We've, I think, gone 6 out of the last 7 years with a frozen budget, and I'm hoping that maybe changes and we're able to maybe even, you know, entrench some of the new things and the new employees that we've been able to bring over the next little while. So those are some quick thoughts.
And I think it's a wonderful way actually to wrap up today's webinar on those thoughts. And you do have our support, and we truly admire what you and your team have done actually in keeping Niagarans safe and the community safe. So thank you for all of that. And on that note, I just 2 public announcements here. We have our member expo tomorrow from 1 to 4. It's a virtual member expo that provides unique opportunities for you to connect with local businesses. Admission is free. It's open to the public. Lots of prizes and lots of great demonstrations and experts that are speaking on a number of topics. And one of the experts actually has to do with the rapid screening kit that the Ontario and the federal governments are making available to smaller businesses. We are one of the chambers from across Ontario that is pleased to announce that in partnership with Great Wolf Lodge, who is a member of the Ontario Vaccination Council, that we will start the distribution of the COVID-19 rapid testing kits as of next week. So I'll ask you, if you go to our website, you can now book your pickup time for those particular kits. It is, again, we want to stress and say that the rapid antigen test kits can identify a significant number of asymptomatic individuals, but it doesn't mean that anything else, all other things still have to be followed. But I think it's something that a lot of employers have asked for, and we're really glad to be able to offer that. So for more information on that, please turn to our website at gncc.ca. As always, this webinar has been recorded and will be available to all participants that are with us today. And again, my thanks to you, Dr. Hirji, for being with us. We're looking forward to next month conversation. We actually thought last month that we didn't have any new questions to ask you, and we had more participants today and more questions to ask. So we expect the same as we're looking at the upcoming months. Thank you for your time and everything else. And thank you to all of our attendees for being with us today. Bye-bye.